The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, plastic surgeon Dr. David Altamira gives his patient the looks she's always wanted. Orthopedic surgeon Dr. Charles Tolson discusses the benefit of a double hip replacement. Vein specialist Dr. Peter Morgan discusses wounds that won't heal caused by venous insufficiency. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
About 40 years ago, I fell down a flight of concrete steps, and I had constant chronic pain in my right leg and hip. As a result of that, the sciatic nerve was damaged, and I was just beside myself with the pain I was experiencing. It felt like there was a hot knife sticking in my right rear cheek, and it was just beyond belief.
Mark was experiencing low back symptoms associated with lower extremity symptoms as well. So he had back pain and radicular pain. And that's a typical patient that we might see for spinal cord stimulation who has either had surgery or they have multi-level degenerative changes. They're not amenable to surgery, and they failed injection therapy, physical therapy. Their medication management is not as appropriate as we would like for it to be. In other words, it's not getting the effect we'd like. Neurostimulation or spinal cord stimulation is a device that we place in the epidural space to short circuit pain. It's kind of like a radio wave and a transmitter and a receiver. So you have a transmitter that transmits this radio wave. If you jam that radio wave, then the receiver never gets that. The brain is the receiver, the spine and the nerves are the generators, and so if you can jam that pain at the level of the spinal cord, then they don't get the perception of pain that they would normally get.
He and the rep from the stimulator company say, "Okay, Mark, we're going to turn it on, and here we go." So they turned it on, and would you believe, I started crying. And they said, "What's wrong, what's wrong?" And I said, "No, nothing's wrong. It's like tears of joy. I don't hurt."
Mark's doing great. You know, he's not 100% pain-free, but it's definitely significantly improved his quality of life.
Ever since then, my life has changed considerably, and oh, for the better. I have a smile on my face all the time. I've done a complete 180 from being grouchy, depressed all the time. I have actually a sparkle in my eyes. It's just amazing what these nerve stimulators can do for a person. And my wife will attest to that. I have my husband back, is what she always says.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Nuts are not only a source of healthful fats and protein, they also are a massive dose of omega-3 fatty acids that can help boost your brain power.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, "Oh, our kids would have really big noses."
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple, and I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process, and he said, "You can always do more, but let's do something modest for now," and it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
I didn't feel good about myself, and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends, and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren, and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area. Natalie has a question for Dr. Anthony Lee. When does my neck pain need medical attention?
Neck pain usually is as a result of muscle strain, and those usually resolve by just rest and intake of over-the-counter pain medications. Now, if your neck pain escalates and it progressively worsens, it involves numbness and tingling of your fingers or your hands, or even worse, if you start noticing weakness, balance disturbances, then you need to see your doctor.
Ask our doctors on bestdocsnetwork.com.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, I have good news and I have bad news. And he says, well, the bad news is both of your hips are in really bad shape. He says, you're going to have the bilateral hip replacement. The good news is I can do it, and I'm happy to do it. Dr. Tolson also had a model of the hip, and he said, this is what the procedure's going to look like. And he talked through the whole thing, and he says, you're going to be a new person once you have these hips in.
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Tolson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
Did you know that blueberries can help improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells.
Well, I had some reoccurring wounds on my legs that just wouldn't heal. It seemed to be worse in the wintertime. Well, I had them probably on and off for a couple of years, but it seemed to have gotten worse in the end of 2011.
Many of the patients that we see that have wounds have had them for many years. On several occasions, we've seen patients that have had wounds more than 20 years. They typically are getting seen at wound care centers or getting treated by a variety of other healthcare providers without success. These wounds occur on the legs. They are frequently very painful. They are not associated with diabetes, which is a common misnomer. They're caused by venous insufficiency or varicose veins.
I had gone to a local hospital, to a wound center, and spent about a month there doing different things, going back every week, and it was no different. And I decided I was just wasting my money there, so.
He came in, we performed a venous Doppler ultrasound on him, diagnosed venous insufficiency. We corrected that venous insufficiency on him using endovenous radiofrequency ablation of the vessels, and all his wounds healed up very promptly, less than 2 months. In fact, some of them were healed within a couple of weeks.
You know, he seemed to have a little bit, better idea what it was. It was a circulation issue as far as the veins, and he talked to me about the different veins that they could do as far as the closing off of things, and I was all for it. He said that he thought it would heal up within no time, and he was correct.
Treating those veins results in relatively rapid resolution or healing of the wounds. Probably the number one reason why I began to specialize in the treatment of venous insufficiency was that I discovered that it was the solution to these chronic wounds that had previously not been treatable.
Seeing Dr. Morgan, he was very personable. He's easy to trust right off the bat, knew what he was talking about, very friendly staff. Like I said, I've never had any issues since, and I've been very happy with the experience.
Request an appointment on bestdocsnetwork.com. Coming up on the second half of today's show, facial plastic surgeon Dr. Yadro Duchik helps his patient improve her appearance and quality of life with a facelift. Oral surgeon Dr. Paul Metz improves his patient's life with dental implants. Craniofacial and plastic surgeon Dr. David Jenikov talks about his approach to facial rejuvenation with his patients. Podiatrist Dr. Gabriel Maislos talks about using laser treatments for toenail fungus, as well as more doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
It's important to first determine that if they're an appropriate candidate for a facelift or not. The general principle is you have to have enough looseness of skin and redundant skin to be a good candidate for facelift. If you don't have enough looseness of skin or laxity, it just won't work very well. You have to preserve the central third of the face, so this oval, if you will, because that's really what defines us as uniquely individual.
I am getting older, and teaching is my third career, and what I observed was the older looking teachers were losing their jobs, and I just wanted to look as young as I could. I had tried a variety of other things, other procedures, and I finally decided to just go for it and go to Dr. Duchik and get everything fixed up. I was impressed by his place of business, as well as his people were all very friendly and helpful, and they just made me feel comfortable. It was overall positive experience, and I felt like he really knew what he was doing.
We have so many minimally invasive techniques available today that really have very little downtime, have excellent results, and make you look more youthful and fresher, because that's the whole point of everything. It's the point to look better. And however we can accomplish that, that's easiest on the patient, that's what we want to do.
I don't think he does things that don't need to be done. So he doesn't push more than you would need, whether that be shots or surgery or whatever. He does what he thinks is going to give you the best result. I definitely am glad I had this done. Most people have no idea how old I am, so I feel pretty good about that. Nobody's tried to fire me for being too old to teach, so I feel pretty good about that. And I'm very happy with the results, very happy.
Find your doctor on bestdocsnetwork.com.
My life before I came to see Dr. Leon was not very high quality. I had a lot of respiratory issues. I couldn't sleep at night. I couldn't go outside and do some of the things I like to do, like golf or tennis or some of the other activities that I enjoyed. So I needed some help with my quality of life. I'm a pilot with American Airlines, and I have to pass certain medical tests, and having allergies can be a deterrent to passing those medical tests.
We in our practice have been doing rapid desensitization for approximately 20 years. We've done over 4,000 patients. It's a very convenient way for patients to do their allergy injections because they can do a large amount of treatment in a very short period of time. It can be done safely in a physician's office with appropriate pre-medication. And this allows patients to reach monthly injections in 4 to 6 months, not only feel better, but get to their maintenance better.
First, we talked and we counseled a little bit about what were my goals with Dr. Leon, what was I trying to accomplish? And so that was the best thing about Dr. Leon. He really had in mind, what do I want out of the treatment? Not what he's trying to do for me, but what did I want out of the treatment? My quality of life today, after being a patient of Dr. Leon's for over 20 years, is much improved. I can basically do anything I want.
The good thing about allergen immunotherapy is that it modifies the disease, so it's really the closest thing we have to a cure. The recommendations by the American Academy and the American College of Allergy, Asthma, and Immunology are that allergen immunotherapy, allergy shots, be administered in a physician's office.
Dr. Leon spends a lot of time educating himself. He attends conferences, he does a lot of writing, he does a lot of research, he talks to a lot of different patients, he looks at other practices, so his knowledge about allergy care is probably the best in North Texas. My close relationship with Dr. Leon and the type of care he's provided allows me to feel more secure about my future at the airline in terms of my medical certificate and being able.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Over 90% of diseases are caused or complicated by stress. Some ways to help deal with the stress in your life are exercising, listening to music, writing in a journal, or going for a walk.